Hemodialysis is a method of removing metabolic waste as well as free water from blood when there is a renal failure. Hemodialysis was first used in 1913 for the removal of salicylic acid in experimental poisoning, but was not tried clinically until 1950 when it was used in the treatment of aspirin poisoning. Since then, it has been considered as silent features. Hemodialysis is one of the three major renal one of the three major renal replacement therapy. The other two being renal transplant and peritoneal dialysis. In this, a patient blood is brought in contact with a semi-permeable artificial membrane on other side, which it is a chemically balanced aqueous dialysis solution. The toxin flow from the patient's blood into dialysate. Other substance, calcium, may flow from the dialysate into the blood, acting to normalize the blood chemistry to achieve adequate total body clearance over the time. Requires a cannula of large vessels. Toxins most amenable to enhanced elimination by hemodialysis are those which have a low molecular mass, less than 500 Dalton, high water solubility, lower protein binding, small volume of distribution, less than 1 liter kilogram per body weight. Normal 0.6 liter per kilogram. 42. Prolonged body clearance. Hemodialysis is useful in prolonged elimination, increase the T half life, increased dialysis clearance relating to the body clearance. Hemodialysis is useful in memories blast, barbiturate, bromide, lithium alcohol, methyl ethyl isopropyl alcohol, salicylate, strychnine, theophylline, thioisonate, stumble, that is isopropyl alcohol, salicylate alcohol, theophylline, uremia, methanol, barbiturate, lithium, ethylene glycol. Okay. Hemodialysis is not useful in anticholinergics, antidepressant, antihistamines, belladonna, alkaloid, benzodiazepine, chloroquine, digitalis, glutathione, opiate, morphine and heroin, methaquinone, paracetamol, phenothiazine, antipsychotics. Next is peritoneal dialysis. That is a procedure in which a patient's peritoneum is used as a membrane across which toxin and blood are exchanged. Silent feature procedure, the patient's peritoneal membrane serves as a semi-permeable barrier between the blood and the peritoneal capillaries and a balanced dialysate solution. The latter is introduced in the patient's peritoneal cavity and allowed to dwell for a period of hours before drain and replace. The osmotic gradient pull the toxins from the intravascular space into the dialysate. Dialysate used for adult is 2 liter, for children less than 5 years 200 milliliter. Effectiveness about 25% of that of hemodialysis. Poisons effectively removed by peritoneal dialysis: alcohol, barbiturate, bromide, chloral hydrate, lithium, mercury, inorganic unidine, salicylate, sodium chloride and theophylline. Okay. Next is hemoperfusion. Hemoperfusion is a procedure in which large volumes of patient's blood are passed over adsorbent substance in order to remove the toxic substance. Silent, it is an extracorporeal form of treatment because the blood is pumped through a device outside the patient's body. Sorbent, most commonly used resins and activated charcoal hemoperfusion. Hemoperfusion is useful even with a high protein bound substances that have a high volume of distribution and are lipid soluble. Acetaminophen, barbiturate, carbamazepine, digitalis, glutathione, meprobamate, methaquinolone, methotrexate, paraquat and theophylline poisoning. Next is hemofiltration. That is, ultrafiltration is a procedure similar to hemodialysis. Poisons are made to move across a semi-permeable membrane with two important differences in hemofiltration and in hemofiltration dialysate is not used. Positive hydrostatic pressure is created by using a pump. Thus, poison move across by convection, a faster process rather than by diffusion, slower process. Silent features The procedure is more akin to natural respiration used by kidneys. Hemodialysis, on the other hand, is more artificial. It is used as a dialysate. Okay. Depending on the duration, two types of hemofiltration, also known as intermittent hemofiltration, 3 to 5 hours per treatment, 3 times a week, continuous hemofiltration, continuous therapy, which is continued for 12 to 24 hours. Depending upon the placement of cannula, it is either continuous arteriovenous hemofiltration, continuous veno-venous hemofiltration, drawbacks. Hemofiltration is relatively a new technique. Its utility is not well established, requires involvement of several specialists from different fields, and cannot be performed in severely hypertensive patients. Elimination rate are much lower than with the hemodialysis and hemoperfusions. Next is a cardiopulmonary bypass. This is a drastic measure used on drugs which are poisonous to the heart, which are normally eliminated by the liver. Lidocaine and flecainide antiarrhythmic. The blood flow is diverted from the heart and lung, as in heart surgery. The blood keeps circulating through the organs, liver and kidney. So gradually poison is cleared from the system, so that the procedure essentially buys time until the patient is detoxified. Dangers and pitfall is liver failure and not useful in hepatic failure. Next is exchange transfusion. Exchange transfusion is a total blood volume exchange administered in a small liquid saline, features very rarely used for toxin removal. Procedure: patient blood is slowly replaced with a bangled blood. 2 to 4 vascular volumes are exchanged. Indications: severe methanohemoglobin in infants in cases where the poison has been massive hemolysis. Poison is strongly bound to plasma protein, cannot be removed by hemodialysis, such as thyroxine, iron, theophylline. Life-threatening injection, poisoning by therapeutic drugs. Complication: bleeding, hypoglycemia, hypertension, hazardous associated with the blood product administration, immune-mediated reaction, blood incompatibility, and infection. Next is intravenous lipid emulsions. Procedure: intravenous lipid emulsions, IV injection of the fine lipid emulsion. It has been used successfully in treatment of several lipophilic poison, especially local anesthetic toxicity. Mechanism of action: it produces an additional lipid single lipid compartment in which lipophilic drugs are sequestrated from the plasma. 3 compartment mode. This makes the lipophilic poison unable to the body tissue. Useful against mainly local anesthetics. Lidocaine, other drugs in which it has been used successfully in experimental are amiodarone, barbiturate, calcium channel blocker, lipophilic beta blocker, and tricyclic antidepressants. Thank you.